I was invited to chair an educational session on resistance to immunotherapy and the role of the tumor microenvironment. And so it was an interesting session where I chaired the session, and then I presented, and then there were two other speakers, Dr. Savoldo and Dr. Koya. And so in particular, my talk was trying to focus on the resistant mechanism to CAR T-cell immunotherapy in the clinic, and trying to present potential strategies to overcome resistance. And so I started by giving an overview of the known resistant mechanism so far. We know that the tumor microenvironment certainly plays a role, but also T-cell dysfunction and the tumor intrinsic mechanism, for example, antigen negative escape, also have a role. But I always like to start by also thinking about the issue of access to this therapy. This is a highly sophisticated, expensive therapy that might result in issues with access. And as a matter of fact, we did a study looking at minority health populations. So I started by talking about that. And then we went into a recent study that is unpublished. We presented that at the American Society of Hematology in 2023, a few months ago in December. And that project is focused on the role of EZH2 and inhibition of EZH2 to enhance CAR T-cell therapy for lymphoma and also for other cancers. We show that actually inhibiting EZH2 is beneficial for the CAR T-cell function because it increases the interaction between the lymphoma cells and the CAR T-cells. And then can also have a role in tumor microenvironment. And lastly, I discussed the recent data that we published in Nature Medicine a few months ago on the risk of T-cell lymphoma after CAR T-cell therapy. So again, it was a talk that was covering some general concept, and then dived in three projects: one on minority, the second one on EZH2, and the third one on T-cell lymphoma risk after CAR therapy.